And we already know COVID-19 can be deadly for seniors, especially those in congregate care settings. Now, new research from Case Western Reserve University shows the risk from the virus is even higher for people with dementia.
News 5's Emily Hamilton spoke with a Willoughby woman who lost her mother to this virus and hopes these findings will help protect other dementia patients.
The first time we met with Sheila Tomczyk in September, she knew her mother's days were numbered.
She's going to be meeting the Lord soon.
But the hands of time turned more quickly than expected.
Mom passed, and she never understood why I couldn't come visit her.
Just hours after our initial fall interview with Tomczyk, her mother Teresa died from complications of COVID-19 while living in the dementia unit of a Northeast Ohio nursing home.
That's how she died, by her, without me.
Fast forward nearly 4 months, and Tomczyk's mother is included in an unfortunate statistic that shows dementia patients are twice as likely to contract the COVID-19 virus than those without dementia. A new study published by Case Western Reserve University highlights the ways in which those with memory loss diseases are being afflicted by the pandemic at an alarmingly high rate.
There was also a remarkable increase once you had COVID, if you had dementia, in hospitalization and in death.
In fact, patients living in congregate care facilities account for nearly 60% of COVID-19 deaths in Ohio. Lead researchers of that study say social isolation plays a key role in dementia patients' inability to recover from the virus.
For patients with dementia, that is terrible. They crave human contact. They crave anything that's familiar.
For Tomczyk's mother, the hourglass ran out of sand less than a week after she originally tested positive for COVID-19.
I didn't get to say goodbye. The last thing I did was I called, and the nurse put her on the phone, and she was trying to talk, but she couldn't. I says, "Mom, I love you and I miss you." And she was just like, really trying to talk. But she couldn't.
Tomczyk says she's not at all surprised by Case Western's new findings.
No family around, nobody around. That's fatal for anybody.
But wishes she could rewrite her mother's final chapter and give her a more dignified death.
If you're sick and you're isolated and, you get depressed, you get lonely, a lot of people lose their will to live.
Emily Hamilton, News 5.